olfactory nerve is passing through. The lining of the nasal mucosa can be divided into three parts. This part is the vestibule. This part is the vestibule. There is a line between the two that is known as limen nasi, and this is the part where we put our fingers. This is basically the part where the external skin of the face has upturned to go to line of the inside of the nose. This is known as vestibule. So it has the features similar to that of the nasal by skin external. It will be covering with stratified squamous epithelium with hair actually. This vibrissae, the hair of the nose, the nasal vibrissae, and it will be gradually converted into non-stratified squamous epithelium, non-keratinized stratified squamous epithelium, and then it will gradually turn into pseudostratified epithelium of the nasal mucosa. Here, the epithelium, it is not shown in the picture, but we can discuss the epithelium covering the nose and the epithelium covering the outer aspect of the superior concha and the corresponding part of the septum. This wall is known as olfactory part. It contains the sensory fibers from the olfactory nerve, and the epithelium is a little different. The epithelium, it's a little pale or brown, yellowish brown as compared to the rest of the respiratory epithelium. Then the rest of the whole, if we take out the vestibule and if we take out the olfactory epithelium, the all that we are left with is the respiratory part. It consists of the pseudostratified ciliated columnar epithelium and pseudostratified ciliated columnar epithelium, and it will contain a lot of the serous and mucous glands that will be a lot of serous and mucous gland that will be keeping the surface moist, and it will contain a lot of blood vessels that will provide the secretions, and that will, in addition to the secretion, they will humidify, they will change the temperature of the air. Let's talk about the lateral nasal wall. We have discussed this vestibular part, the vestibule. It is forming the anteroinferior part of the lateral nasal wall. And then there is the three shelf, the three concha, the three turbinates. These are the superior concha, the middle concha, and the inferior concha. We have talked about their bony bones. The inferior concha is an independent bone. The middle concha or turbinate and the superior concha are the part of the ethmoidal bone, and they are larger to smaller as we move from down to up. The superior concha, and between the two, the areas that are present beneath them, these are known as meatus. So beneath the superior concha will be superior nasal meatus. Beneath the middle concha, there will be middle nasal meatus, and between the inferior concha, you guessed it right, inferior nasal meatus. And there is another space between the roof and the superior concha that is known as sphenoethmoidal recess. So next we will be talking about these four spaces, the three meatus, the three meati, and the sphenoethmoidal recess, and we will talk about the structures that are opening in each and one of them. Let's work our way from top down. The sphenoethmoidal recess, lined by respiratory epithelium below between the two, and the structure that is opening inside it is this, the opening of the sphenoid air sinus. It is opening it right here. This is the opening, the sphenoid air sinus. Let us discuss further on the image below. So sphenoid air sinus, it is opening into the sphenoethmoidal recess. Okay, next let's do the superior meatus. Superior meatus does contain the opening of the posterior ethmoidal sinuses. It consists the opening of the posterior ethmoidal sinuses. This is the only opening. The interesting thing that is here, the Attachment of the middle concha. The attachment of the middle concha known as basal lamina or ground lamina. For the middle nasal concha, the attachment. It's called basal lamina. Alternate name is ground lamina. This is basically the demarcating line between the ethmoidal air sinuses. The sinuses that are opening to the posterior aspect, will be the posterior ethmoidal air cells, and the ones that are opening to the anteroinferior will be the anterior group of cells that will include the anterior and the middle ethmoidal air sinuses. This is the superior meatus. Let's get done with the inferior meatus first, then we will go to the middle meatus. It is a very big topic. The inferior meatus contain a very important one opening. That opening is the opening of the nasolacrimal duct. That is the opening of the nasolacrimal duct. The tears, the secretion from the lacrimal gland, it moves through the orbital cavity, through the orbital canal, through the lacrimal canal in the lacrimal duct, and it opens here. Then we are left with this, the middle meatus. It has a lot of structures and the opening, and this whole structure is called osteomeatal complex. Let us discuss them here. Here, the first thing, that the big bony projection, that is known as bulla ethmoidalis, the ethmoid bulla. It is due to the middle ethmoid sinuses. The middle ethmoid sinus air cells, they have raised this wall to form the bulla ethmoidalis. In front of it, there was the uncinate process. Here, this bone was the uncinate process we saw in the lateral wall. It is right here coming like this. Between the margins of the two structures, this uncinate process, and then there is bulla ethmoidalis. Here is the bulla ethmoidalis, and in between them, if we fit a piece of paper between the anterior margin of the bulla and the posterior margin of the uncinate process, this piece of paper, this 2D space, this will be known as hiatus semilunaris. This is the 2D space. This is a piece of paper that is between the anterior margin of the ethmoid bulla and the posterior margin of uncinate process. If we pass through this piece of paper, if we pass through this sheet, if we pass through this 2D plane, you go back to a gutter-like space. This gutter-like space, it is called infundibulum. This space is called infundibulum. So this is the difference between the hiatus semilunaris. This was the 2D entry to the 3D infundibulum. But if you are confused by it, don't worry. If you use it alternatively, you don't get scolded that much. They You can take the meaning that they are similar to one another, but they are not actually. So that is what I have been saying. This whole gutter like space that is present between the uncinate process laterally and the this this orbital plate of the ethmoid bone medially, like here. So this space is called infundibulum between the two, and this is the infundibulum. So here, this space where it was entering by hiatus, and this gutter-like area which is present between the two bones, the ethmoid bone and the uncinate process, that is infundibulum. Now there is a lot of openings in the osteomeatal complex. On the top of the bulla ethmoidalis, there are opening of the ethmoid air cells. Purple arrows are shown coming out of it. These are middle ethmoidal air cells that are opening right here. In the infundibulum, the most prominent thing are the three sinuses are opening here. If we go all the way up, it is draining the frontal sinus. The opening of the frontal sinus is coming here. If we come back, The cells of the anterior ethmoidal sinuses, these are opening in the floor of the infundibulum. If you go all the way back, then there is the large opening of the maxillary sinus, maxillary ostium. Let us quickly revise in this picture. So you have seen all of these things. So there was sphenoethmoidal recess. There is sphenoethmoidal recess giving the opening of the sphenoid sinus. There is superior meatus giving the opening of the posterior ethmoidal cells. There is middle meatus with the ethmoid bulla in back and uncinate process in front, and in between them there is an opening called the hiatus semilunaris getting inside the infundibulum. On the top of the ethmoid bulla, there was middle ear sinuses, ethmoidal air cells. On the top of the infundibulum, there is an opening of the frontal sinuses, frontonasal duct that is shown by a probe here. There is small, minute, dot-like openings of the anterior ethmoidal air cells, and on the postal inferior aspect, there will be opening of the large opening of the maxillary sinus of high mole. So that's about it. Here it is not very made prominent. This in the front of the middle meatus, here is a depression that is known as mestentrum. This is known as, I'm getting a little blank here. I will go back to it shortly. And in front of it, there is a raised portion that is known as agar nasal. This is a ridge that is present between the two. So this is all about the lateral wall. We have talked about middle meatus, bulla ethmoidalis, hiatus semilunaris, infundibulum. What is the difference between the two? What was the boundaries of the hiatus semilunaris, ethmoid bulla behind, uncinate in front inferiorly? What was the boundaries of infundibulum, uncinate laterally, and orbital plate medially, orbital plate of ethmoid? We talked about frontonasal recess, this frontonasal duct, canal, frontonasal recess, and then we also talked about the ground lamina that was separating the posterior set of ethmoid cells and anterior set of ethmoid cells. These are the same things that we talked about. The agarnizae, agarnizae are basically the due to the raised area that is due to the anterior ethmoidal air sinuses. The middle turbinate has a very unique shape. This picture will be of the middle turbinate of the lateral left nose, the left lateral turbinate, and the purple area that is the attached margin. So this is towards you, towards the outside of the screen. So it has three parts. It has the part that is attached to the inferior margin of the cribriform plate. That is the first part. There is a part that goes laterally to the cribriform plate that to reach the lateral wall, and it goes down. This is the second part, and the part that goes inferiorly and then posteriorly. This is the third part. This is the attachment of the middle meatus. So middle meatus chiefly consists of this vertical bone in the first part. It consists of the backward facing plate in the second part, and it consists of a roof and the lateral wall. There are two structures right here, roof and the lateral wall, and this will be the third part. It is shown right here. The vertical, the backward directing, and the roof part, that are the three parts of the middle meatus. Don't worry if you forget it, but I just mentioned because in a books where the detail is given,